A closer look at Robert F. Kennedy Jr., President-elect Trump's choice to lead the Department of Health and Human Services. A number of groups on both sides of the political spectrum raising concerns. And ABC's Jay O'Brien is in Washington with more. Jay, good morning.
Good morning, Whit. President-elect Donald Trump has been clear he wants his pick to run HHS, Robert F. Kennedy Jr., to, quote, go wild on public health as Kennedy prepares day one plans that could impact millions of Americans.
This morning, Robert F. Kennedy Jr. promising massive changes and potentially significant turnover at federal public health agencies if he takes the helm of the Department of Health and Human Services.
In August 23rd of this year, God sent me Donald J. Trump.
The environmental lawyer also known to spread debunked claims that vaccines cause autism, telling Fox News this in 2023.
I do believe that autism does come from vaccines.
The idea sparked by a decades-old study that was retracted years ago. Multiple independent studies since have found no link between vaccines and autism. Kennedy pledging he doesn't want to take vaccines away, and despite his skepticism, has previously claimed he and his 7 children were fully vaccinated. He's pushed misinformation on vaccines and saying that they're linked to autism. That's not a concern for you?
We'll have oversight. I think it just pushes the envelope, and that's what we need.
The one-time long-shot third-party presidential candidate dropping out this summer, endorsing Trump and entering his inner circle.
He's so into health and all. He's going to take care of women's health and men's health and your children's health.
Now, Kennedy's top priorities include tackling processed foods, including a proposed ban on additives like food dyes, changing the FDA's nutrition guidelines, pushing to end the practice of adding small amounts of fluoride to prevent tooth decay to Americans' drinking water. Kennedy claims fluoride, recommended for U.S. drinking water since 1962, is linked to low IQ and bone density issues. But the studies he references are preliminary and only looked at high levels of fluoride exposure, not the low levels currently recommended.
Now, Kennedy would still have to be confirmed by the Senate, which could be a rocky process given the controversial nature of this nomination. That is, unless Senate Republicans allow Trump to appoint him and potentially other cabinet picks through what are called recess appointments and sidestep the usual confirmation hearings and confirmation votes. Whit.
All right, Jay O'Brien for us, thank you very much. And joining us now with more on this is Dr. Ashish Jha, Dean of Brown University's School of Public Health and former White House COVID-19 response coordinator. Dr. Jha, good morning to you. It's good to have you back on the program. So voters chose to send Donald Trump back to the White House knowing that RFK Jr. would have a large role overseeing our nation's health. You've worked closely with prior HHS directors. What specifically concerns you about some of Kennedy's positions?
Yeah, good morning, Whit. Thanks for having me back. Yeah, look, presidents are afforded their leadership team, and President Trump should obviously be afforded that as well. This is a very concerning pick, a one that I think can potentially do a lot of harm to the American people. Previous HHS secretaries have left the big decisions of treatments and medical coverage of Medicare to experts. RFK Jr. holds a whole set of conspiratorial views about vaccines, about HIV, about medicines, that I really think if he tries to inundate or affect decision-making inside HHS with any of those ideas, I think it can end up being quite dangerous for the health of the American people.
So another thing that we discussed earlier is that he pushed to remove fluoride from public drinking water, even though it's been a practice for years. Many use toothpaste now with fluoride in it. Is it still necessary to have it in our drinking water? What is the latest guidance and debate on this issue?
Yeah, no, look, there's pretty good evidence here that at a basic level, I mean, you obviously can do too much, or you can do too little, but if you get the level right, which most places in America have, there is clear benefit in terms of reducing tooth decay. We have good evidence from Alaska recently. Alaska got rid of fluoride in water, and they saw a dramatic increase in dental caries in kids in the months and years that followed. So I think that evidence is very good, and I think that evidence is compelling for why we should continue keeping fluoride in water.
And you talked about some of the things that are more controversial, but some of his proposals are much less controversial and have contributed to his popularity. Things like improving nutrition standards, removing potentially harmful additives to food. Is that something where we could see some consensus in the medical community?
Now, look, a lot of us have been arguing for better foods, right? We have too much processed foods. Obviously, we have an obesity epidemic that's a real problem. I think the question that I wonder about is how are we going to make those decisions and who's going to make those decisions? The way we should be making those decisions is looking at the scientific evidence, the data through analysis. And unfortunately, RFK Jr.'s track record on this is that he doesn't really adhere to those analyses. So if he lets the career scientists at the FDA and CDC make those decisions, great. I think that would be a good thing, and I think we'd all benefit from it. I just worry his track record, I think, raises a lot of concerns for us about how those decisions are going to get made.
All right, Dr. Jha, and again, there is a process here that he has to go through the confirmation. We'll see how that plays out. Dr. Jha, we thank you for your time this morning.
Thank you.